This video was made by Evan Bilsbury, Joe Underdonk, and Don Buie. Antisocial personality disorder, or ASPD, is a personality disorder that affects about 0.2 to 0.3% of the general population. However, ASPD affects more than 70% of the prisoner population. Those with ASPD do not conform to social norms and are often deceptive, manipulative, and impulsive. This is why they often end up in prison or incarcerated. Possibly due to a missed period of development in the prefrontal cortex, individuals with ASPD have very poor impulse control, and their behavior is affected adversely because of this. A lack of moral reasoning causes them to be deceptive and reckless in their interpersonal relationships and decision-making. These individuals also lack empathy. This means they do not have the ability to relate to others, and this affects their emotionality and their ability to make bonds with others. Because of the nature of the disorder, most individuals do not recognize the need to seek treatment. Those with ASPD have a grandiose self-image and do not believe anything is wrong with them. For this reason, much more emphasis should be given to looking at predictors of the disorder. Notably, the onset of conduct disorder before the age of 15 is seen as a precursor to ASPD when the individual is 18 or older. Those with conduct disorder violate the rights of others and the societal norms with their behavior. We will now look at some environmental high-risk factors for those with ASPD. The most notable environmental factor is problems in the family. Parental neglect has been related to unemotionality in children, and ASPD has also shown to be correlated with a delinquent sibling, a psychiatrically treated mother, poor parenting practices, and large family size and low family income. Research conducted in 2007 found that emotional dysregulation is linked to conduct disorder in adolescence. According to the DSM-5, a formal diagnosis of ASPD requires that 3 or 4 of the following symptoms be present. First, the individual fails or finds difficulty conforming to social norms. Deceitfulness, as characterized by taking advantage of others or lying frequently. Impulsiveness to the point of impairment. Lack of regard for the lives/safety of others and themselves. And finally, a lack of empathy for others. While these symptoms are similar to those of conduct disorder, an individual younger than the age of 18 cannot be diagnosed with ASPD. However, a formal diagnosis often requires that a history of conduct disorder be present prior to the age of 15. As stated earlier, due to the relatively low frequency of ASPD in the general population, the sheer lack of research, and the tendency of those with ASPD to refrain from seeking treatment, there is currently no empirically supported treatment method for ASPD or for many other personality disorders. Therefore, in the case of ASPD, the closest thing to treatment we have is prevention. This, however, requires a further investigation into the risk factors of ASPD on multiple levels: biological, cognitive, and sociocultural. The prefrontal cortex is the area of the brain that organizes one's actions into agreement with their personal, internal goals. The prefrontal cortex also carries out executive functions, determines between good and bad, and suppresses urges that are not socially acceptable. In the year 2000, researchers found an 11% reduction in prefrontal gray matter volume in those with ASPD. This experiment provided evidence for a structural brain deficit in ASPD. These gray matter deficits may explain the stunted emotional growth, lack of conscience, and poor decision-making of those with antisocial personality disorder.
While it's common knowledge that the media in general plays a big role in influencing behavior, a recent study that involved 80 university students indicated that the type of media heavily influences the impact it has on its users. This study in particular utilized video games to showcase this phenomenon. Each student was randomly asked to play one of 2 video games. Trauma Center Under the Knife considered the pro-social game, or Manhunt considered the anti-social game. The results of the study seem to indicate that games that promote antisocial behavior, such as promoting violence or theft, tended to lead to a subsequent increase in antisocial behavior, such as social withdrawal or general disregard for others. The type of game and the nature of the protagonist also seem to influence the subsequent behavior of the user. For instance, single-player games involving a malevolent protagonist or antisocial character, such as GTA 5, seem to have the most negative impact on players, while games showcasing a prosocial character, such as Dr. Styles and Trauma Center Under the Knife, tend to have the most positive impact on players. It should be noted that both games display blood and gore, however the context is obviously relevant.